7 daily habits that quietly damage your heart. The habits destroying your heart right now are not the obvious ones, they are the invisible, normalized daily routines that cardiologists see in nearly every patient before the crisis arrives. Segment 1. The normalization of cardiac damage. Heart disease does not build itself from dramatic moments. It constructs itself methodically, brick by brick, day by day, from the accumulated biological consequences of habits so thoroughly normalized by modern life that most people never once identify them as threats. The dangerous assumption most people carry is that cardiac risk is primarily genetic, primarily age-related, and primarily addressed through medication when the time comes. The research dismantles this assumption comprehensively. The overwhelming majority of cardiovascular events, heart attacks, strokes, cardiac arrests, occur in individuals whose primary risk factors were behavioral and dietary, not genetic. And the behaviors driving those risk factors were not exceptional. They were ordinary. They were the habits of daily life that nobody warned them about because everybody around them was doing the same things. What follows are 7 of those habits, the ones operating quietly, chronically, and compoundingly inside the cardiovascular system of the average person living a modern life, and the specific biological mechanisms through which each one is shortening the life of the most important muscle in the body. Segment 2. The 7 habits and the cardiac damage each one causes. Habit 1. Prolonged sitting without movement breaks. Sitting for extended, uninterrupted periods, the standard condition of desk-based professional life, imposes a specific and measurable cardiovascular burden that regular exercise does not fully counteract. Even in individuals who train consistently, prolonged sitting reduces the activity of lipoprotein lipase, the enzyme responsible for clearing triglycerides from the bloodstream, by up to 90% within hours of sustained inactivity. Triglyceride accumulation in the bloodstream is a direct risk factor for atherosclerotic plaque development. Simultaneously, blood flow velocity through the lower extremities decreases significantly during prolonged sitting, reducing the shear stress on arterial walls that normally stimulates endothelial nitric oxide production, the primary mechanism through which arterial flexibility and anti-inflammatory protection are maintained. Research consistently documents that individuals sitting for more than 8 hours daily exhibit significantly elevated cardiovascular mortality rates compared to those who interrupt sitting with regular movement, and critically, this elevated risk persists even in individuals who exercise regularly outside of work hours. The cardiovascular damage of prolonged sitting accumulates during the sitting itself, not simply from the absence of exercise elsewhere in the day. Breaking sitting with 2 to 3 minutes of walking or movement every 30 to 45 minutes substantially restores lipoprotein lipase activity, maintains endothelial shear stress, and significantly reduces the postprandial blood glucose and triglyceride elevation that sustained inactivity produces. Habit 2. Chronic sleep deprivation. Sleeping fewer than 6 hours per night, a pattern affecting a substantial proportion of the working adult population, produces a cardiovascular risk profile that accumulates with every consecutive night of insufficient rest and persists even when occasional longer sleep is obtained. During adequate deep sleep, blood pressure undergoes nocturnal dipping, a 10 to 20% reduction in both systolic and diastolic pressure that represents the cardiovascular system's only genuine recovery window across the 24-hour cycle. Individuals who fail to achieve adequate nocturnal dipping, due to shortened or fragmented sleep, maintain elevated blood pressure throughout the night, imposing continuous mechanical stress on arterial walls during the period when the cardiovascular system is biologically designed to rest. Chronic sleep deprivation elevates cortisol, increases sympathetic nervous system tone, raises C-reactive protein and other inflammatory markers, impairs endothelial function, and elevates resting heart rate, addressing virtually every major cardiovascular risk mechanism simultaneously in the wrong direction. Research involving over 1 million participants documents that sleeping fewer than 6 hours per night is associated with a 48% increased risk of coronary heart disease and a 15% increased risk of stroke compared to individuals sleeping 7 to 8 hours. Habit 3. Chronic psychological stress without deliberate regulation. Unmanaged chronic stress is a primary and independent cardiovascular risk factor, one that operates through biological mechanisms entirely distinct from and additive to those of dietary and exercise-related risk. The sustained sympathetic nervous system activation produced by chronic stress maintains elevated heart rate, elevated blood pressure, and elevated cortisol continuously, imposing mechanical and inflammatory stress on the arterial wall that, compounded across months and years, accelerates the endothelial damage and atherosclerotic progression that produce cardiac events. Cortisol promotes the deposition of visceral abdominal fat, the fat depot with the highest metabolic and inflammatory activity and the strongest independent association with cardiovascular risk. Chronic stress drives platelet aggregation, the tendency of blood cells to clump, increasing the risk of the clot formation that precipitates heart attack and stroke. Beyond its direct biological effects, chronic stress drives the behavioral patterns most damaging to cardiovascular health: disrupted sleep, poor dietary choices, physical inactivity, and increased consumption of alcohol and tobacco, creating a compounding behavioral and biological risk profile that neither the stress nor the behaviors alone would produce. Habit 4. Excessive sodium consumption through processed foods. The majority of dietary sodium consumed in modern populations does not come from the salt shaker. It comes from the processed, packaged, and restaurant foods that constitute the majority of calories consumed in industrialized dietary patterns, and its cardiovascular consequences operate through mechanisms that are both direct and chronic. Excess sodium drives fluid retention, increasing blood volume and the mechanical pressure against arterial walls with every heartbeat. Chronically elevated blood pressure, the direct consequence of sustained sodium-driven fluid retention in susceptible individuals, is the single most significant modifiable risk factor for cardiovascular disease globally. It accelerates arterial stiffening, promotes left ventricular hypertrophy as the heart works harder against elevated resistance, damages the endothelial lining through the mechanical stress of elevated pulse pressure, and increases the risk of both hemorrhagic and ischemic stroke through its effects on cerebrovascular integrity. Research demonstrates that reducing dietary sodium by as little as 1 gram per day produces measurable reductions in blood pressure that, sustained over time, translate to significant reductions in cardiovascular event rates at the population level. The primary intervention is not reducing cooking salt but reducing the consumption of ultra-processed foods in which sodium is present in quantities far exceeding what most people consciously recognize or would deliberately add. Habit 5. Regular alcohol consumption. The cultural narrative surrounding moderate alcohol consumption and cardiovascular health has been substantially revised by more recent and methodologically rigorous research, and the revision is unfavorable to the previous consensus. Alcohol is directly cardiotoxic in a dose-dependent manner. It is metabolized to acetaldehyde, a compound that directly damages cardiac muscle cells, disrupts the electrical conduction system governing heart rhythm, promotes the atrial fibrillation that is the most prevalent cardiac arrhythmia in adults, and generates the oxidative stress that damages the vascular endothelium. Regular alcohol consumption elevates blood pressure, raises triglycerides, disrupts sleep architecture, specifically suppressing the deep sleep stage is most critical for cardiovascular recovery, and promotes the inflammatory signaling that drives atherosclerotic progression. None of these 7 habits announces itself as dangerous. None of them produces an immediate consequence severe enough to compel behavioral change in the moment. They are dangerous precisely because they are ordinary, because they blend into the texture of daily life and accumulate their biological consequences invisibly, incrementally, and over decades during which the window for natural intervention remains wide open. Sitting less, sleeping more, managing stress deliberately, reducing processed food and sodium, eliminating alcohol or reducing it significantly, drinking adequate water daily. Each of these changes costs nothing. Each of them reverses a specific biological mechanism driving your cardiac risk. And each of them, applied consistently, produces measurable improvements in the cardiovascular markers that determine how long and how well your heart continues to work. Your heart has been absorbing these habits without complaint. It has been compensating, adapting, and continuing, as it always does. But compensation has limits. And the time to address the habits pushing against those limits is not after the crisis. It is now. While the heart is still asking quietly rather than screaming.